So, in terms of the BSH Nurse Forum update, we wanted to just briefly talk to you all about 25 in 25, which Professor Wheatcroft mentioned this morning in his session. And hopefully some of the heart failure people in the room will have heard of it, some of the renal diabetes you might not. But basically, we just want to make sure that you know a little bit about it, because when I first heard about it myself, what struck me is how pivotal the nursing role is going to be to the strategy. So these are our disclosures. So 25 and 25 is really important, as we've heard this morning in the slides, that the burden of all of these comorbidities is increasing, and we know that just like diabetes, we've got undetected heart failure cases in the community. We also know that when we diagnose heart failure, by the time we make that diagnosis, patients are sick enough to be in hospital. So we've got some huge targets for improving heart failure care and early diagnosis, but we know in the heart failure world that if we are speaking only to our heart failure colleagues about that, we're not going to achieve that aim, particularly as what we're trying to do is detect the undetected. So we need to pick up these patients who nobody knows has heart failure yet. So the people who are going to do that are not the heart failure professionals, it's the thousands of millions of contacts they're having with healthcare professionals for other reasons every day. So the current status of heart failure care over the last 25 years, you could say that it's quite a success story, because we have those new drugs that Professor Wheatcroft was talking about this morning. We have specialist nurses, and the mortality risk has declined a little bit. However, we know that we're not doing enough of that prescribing of specialist medications, and as I've already said, we are not detecting people with the undetected heart failure in our community. So, every year there are 84 million general practice nurse appointments. I don't know how many diabetes nurse appointments there are, or renal nurse appointments, but there's also nurses on wards, there are nurses in leg clinics who are seeing swollen legs. So nurses, knowing what the symptoms of heart failure are and saying, could this be heart failure? If we can spread that around our nursing community, we can find those undetected patients, I believe. So I'll hand over to Becky now.
Hopefully my mic works, is that right? Yes. So what we're looking at really is these four key areas. So trying to identify those with heart failure. We know that 80% of heart failures are admitted in hospital, and we need to change that in order to protect these patients for their health long term. So we need prevention strategies, identifying those at risk, having early and accurate diagnosis, and then making sure the patients are getting the right treatment at the right time. And that will really impact the mortality of these patients. So one way the BSH has moved forward since last year at the last conference is to create a tool that's on their website. This has lots of contacts interactive. It's got guidance, policies and advice about how to detect, protect and what to do with patients with a diagnosis of heart failure. It also provides really good advice about palliative care and when to consider an admission and what can be managed in communities. So it's a really good interactive tool. It's free, it's on the website, everyone can access it, and we really advocate its use. We wouldn't be able to do all the work we want to do in 25 and 25 without collaboration, so including the DSN and UK, but also loads of stakeholders have really helped us get to this 25 and 25 declaration, and so we're only going to be able to impact patient care with all this collaboration. And one thing that we're looking at in the future is this fast track community initiative. So this is about detecting and detected in the community, and we're looking for 3 to 5 sites to help us show how we can really impact the mortality rates of heart failure patients by engaging in the community in a collaborative way. So applications out at the moment, and we look forward to seeing what this can show us in terms of the research in the next couple of years.
Thank you. We'll hand over to Helen and Claire from UK.
Thanks everybody. So we've just got a few just a couple of key messages hopefully, just about kidney care. So we've mentioned that we had our UK Kidney Week conference that was in Wales and obviously. And every year we have World Kidney Day, and that was in March this year. So and we've also had our UK conference in April in this conference centre. Those are my disclosures. So really all I just want to mention is this is something that's big and important in the kidney world, but it's really relevant to everybody here today. So this is the Renal Transformation Programme. So this has been a piece of work going on for the last 18 months, and the toolkit has literally just been launched. So there's a couple of arrows which have moved, and I don't know how they've moved. They've obviously moved when the slides are sent across, but they're pointing down to 2 key areas for the relevant ones. I don't think we've got, oh, I've got things there. There you go. So there's 2 key areas that I think are really relevant to this audience. So that's acute kidney injury and integrated CKD. So we've heard lots and lots already this morning about early detection, prevention, and that was really timely what we just said about the project for 25-25. So I would advocate that you try and look at this. Now, it's not easy to find at the moment. I did struggle. I happen to have a copy of it. It's on the future NHS website, but it will be available. And the reason is that this is a lot of this work around integrated CKD sits in primary care. So we're really keen, like everybody, is finding those patients with early CKD so we can hopefully prevent that progression, which we've heard a lot about. And in line with that, the only other key message that I wanted to get across really is about the KFRE. So this was added into the NICE guideline last year, so I know last year it was mentioned, and I've just put up an example of why this is really important. So you can see, I've just used the laser, I've just used a case, and if any of you are quick enough, and we probably haven't got time, if we would have had time, I would have said get it up on onto your phones and just put in that information. So the KFRE is just a quick and easy tool you can put onto your phone. You just need the gender, the age, the EGFR and the ACR. So the key message for me today is this measurement of ACR, and then you can do a kidney failure risk equation. So the NICE guidelines has put in that referral to a nephrologist is when that 5-year kidney failure risk is more than 5%. I would say, and Darren might help me out here, but I think there's a bit of a debate around that may overestimate people coming into kidney services. But it's really, really helpful and can be done by anybody as long as you've got that information. But obviously, that relies on us having a urine ACR. So those are my 2 key messages about kidneys. I know that there was a report mentioned that this morning that came from Kidney Research UK that is also really important, but Claire's just going to talk a little bit about the UK.
So, as we heard this morning, we're all very fond of working in silos, and that's no different in renal care either. So we're all specialists in very specific areas of renal care, and some of us work across a multitude of those. So we're really proud within our UK that we've actually brought together an education package which is fully online and 30 hours of training in these are the key topics that we've got then, as well as supplementary webinars and support that you'll find. So all the resources for this are on the UK website, but it's literally just gone live now within the last month. So this is one of our key objectives that we set out when we brought together our UK in terms of the education. And we're really pleased that this is now available, but obviously as a group of specialists interacting with patients throughout their renal diseases, then this is really important as well, just to give some background or some specialist knowledge on particular topics. So it would be really good if you can have a look at that and see if there are things that would be of interest to you and your units within that there. And the other thing then that we've particularly wanted to foster with our UK is our communities of practice. And you'll see there that we called them special interest groups, and we've moved away from that to make them become communities. So this is to try and break down some of the silos that we've got within our working, but also to bring together experts and develop that network that Alison referred to in her presentation. That's really important to bring together people who are working in very isolated departments sometimes in their own hospitals, but have similar people across the UK that are doing similar roles, driving practice forward. And this is one of the ways that we can bring people together to look at some of these key topics and help to drive, as nephrology nurses and specialists, help to drive this forward. So you can see one of our home hemo nurse specialists who's part of the home dialysis communities of practice I'll get used to it, it's new, has put there in terms of what she got out of coming together as a collaborative to take forward workforce planning and to really design the services for the future. So again, it's just something that we're really trying to work on as specialist nurses, to try and bring together people, to help them network, to help them drive things forward, and for us as an organisation to help people to do that. So there's just a few things that hopefully you can see that we're trying to work to, but also resources and tools that we'd love you to join as well. Thank you.
Thanks, Claire. That's the State of the Nation done now.